Welcome to creating a strategic roadmap for collaborative and effective evaluation in tribal communities. On behalf of the Children's Bureau, my name is Melinda Baldwin, and my partner in crime, Brian Deakins. We welcome you and are very thankful for your participation this afternoon. Also, thank you to Johns Hopkins for this great space and also for being able to hold it during this week while you're all here. This particular work group is one of three that rose out of the Children's Bureau's Evaluation Summit that was held 2 years ago. And during the summit, it became very apparent from the participants there that an ongoing dialogue about evaluation in child welfare communities and different contexts was very important. So we convened three work groups of experts to continue that dialogue and to work on different aspects of it. And this work group is focused on evaluation of child welfare programs in tribal communities. So without further ado, I'd like to introduce Nancy Dufresne, and she will be our first presenter this afternoon.
Thank you. Good afternoon and welcome. As Melinda said, this is our first attempt at discussing and bringing out the results of our work over the past year and a half. And we really look forward to your feedback as well as your comments. We are a very small group of the larger work group, so we are representing a number of individuals that will be also introduced later through the process. My name is Nancy Dufresne. I currently am the Director of Social Services for the Confederated Tribes of the Chehalis Reservation in Washington State. Next month will be 40 years that I have been working in Indian country from the East Coast to the West Coast. From the 80s on till present, I have been in the Northwest Plains and the Northwest area. So I have had the experience of variety of background experience in education as well as social services. Each of our presenters today, and I'm here with Carlette Randall from JBS International. She will also give a brief bio, as well as Nancy Rumford-Whitesell from the Centers of American Indian and Alaska Native Health from the University of Colorado. And we do have a fourth presenter who is currently not here, but will be joining us in a little while. She's currently doing a webinar, and that will be Alita Meyer from the Office of Planning, Research, and Evaluation from ACF. So I just want to reiterate a little bit of what Melissa said. This is a very brief overview. You will be getting the full draft document of the plan that we have worked on, and really look forward to your feedback and your direction. Oh, that's right. I have to do this. I'm not a real good computer person. So one of the things that we are doing is we're starting from the end and we're moving forward to the beginning. This is the end result. And this roadmap, although it may look very complex, it may look very daunting, we will be breaking it down throughout the course of this presentation, and you'll, I think, identify the fact that it really is relatively smooth. We've tried very hard to bring in all of the components of what it means to respond to evaluation and research within Indian country, within the context of Indian country, rather than the context of the dominant society or the current process. So we're trying, and what we had tried to do is reestablish the context of evaluation through a community approach rather than an academic approach, because we need that partnership. We need that joining together to have an outcome that is truly reflective of a true evaluation that identifies strengths as well as challenges, but in a context of community.
So I am Nancy Whitesell. You guys know me if you've been in the class this week. And my role in joining this work group was just to bring sort of the academic perspective to this conversation on a work group that you'll see when Carlette will be introducing the work group later, is mostly made up of child welfare professionals, people working in communities, and tribal members. And I wanted to give you a little bit of background context as to where this came from. And Melinda already introduced this a little bit. The child welfare research and evaluation work groups that she talked about that were launched as a part of the National Child Welfare Evaluation Summit. The goals of these work groups, as she said, were to engage stakeholders in evaluation practice, to have those discussions, really to get the conversation going and have some sustained conversations about how to improve evaluation practice. And there were the 3 work groups, the other 2, which ask Melinda, not me, I don't know anything about them, but the Child Welfare Evaluation Work Group is what led to the roadmap. This was the purpose statement that we were given when we were drawn together as a work group. This is what Children's Bureau told us that they wanted. And I want to spend just a few minutes sort of walking through this so you get the context of where we started and what we were charged with doing by the Children's Bureau. So the first thing was just the note that child welfare systems are striving to achieve better outcomes. And I think this applies to whether it's child welfare systems, whether it's early home visiting systems, programs, whether it's Head Start programs, early Head Start, child care, all of the work that we're doing in tribal communities and early childhood, that's our goal, is to achieve better outcomes. And keeping that as the focus as we were moving through, that's the focus of evaluation. There's a purpose in mind. It's to achieve better outcomes. The other thing that's noted in this charge was that expectations for accountability and effectiveness have risen. And one of the things we talked about in the work group was they've always been there, but there seems to be a little bit more of an emphasis on really demonstrating accountability. So accountability for really what we're doing is effective and makes a difference was another piece that was at the forefront as we put this together. The next was that child welfare systems toward that end have been really pushed to seek better ways to collect, manage, use data to ensure quality and informed decision making. There's a lot in that sentence. The collecting, having the infrastructure and the skills to collect that data, analyze it, use it, and really, again, that the point is the point of gathering all that data, answering all those questions, is to ensure quality and informed decision making about where do you go next, what's the next step. This is another thing, the point of encouraging programs to pursue more rigorous evaluation practices. And you know from working in tribal communities that idea of rigorous evaluation is sort of a loaded term. And we spent a lot of time in the work group talking about what does that mean and what does it mean not just to be rigorous from the scientific perspective, but rigorous from a culturally competent, culturally embedded evaluation perspective. And the last thing here was that with all of this going on, there's a very keen recognition that the context of child welfare in tribal communities is unique and different. And standard practice for evaluation isn't going to fly and hasn't been working well. And so part of the goal of this, at least as we interpreted this charge in the work group, was to step back and say, how do we do this better? What can some guidelines be for moving forward and doing this more effectively in tribal communities? And with that, I'm going to hand it over to Carlette to tell you about the work group.
Well, thank you. I'm Carlette Randall. I am a member of the Oglala Sioux tribe, and I work at JBS International, and I was fortunate to be asked to participate on this work group, and I was very privileged to be among a lot of national evaluators, both non-tribal and tribal. So the list, you probably all know people who are on there, but we have also the staff from the Children's Bureau. And so we all worked as a work group, and then there were several of us from the larger work group that are on the steering committee. We had several meetings, and we worked as a steering committee to come up with the framework and then report back to the larger group to get feedback from the rest of the frame group on the framework and get a lot of direction and ideas and important subject matter to consider in all of this. So it's a very collaborative effort with this work group. We had a cornerstone. Mary Jane Peck from JBS International held it all together for us, kept us on track and moving. So I think we had a really good team that helped us move forward. And then we also had the Children's Bureau staff give us some guidance, even if Melinda said they didn't do as much, but they provided some guidance that was really needed for us because as the framework is expected to cover more than just child welfare, it's also for Head Start, it's also for early childhood. The framework can be used in any evaluation work for tribal communities. So we're going to talk about how we were operated as a group, which is really, I think, key for moving and accomplishing what was accomplished in the time frame that we were given. So we met in the summer of 2012 as a steering committee, and we had several meetings to set the stage in how to move forward. It was a time to really become a group, start coalescing around working together, developing goals, and moving forward. Once we established ourselves as a steering committee group and then working with the larger work group, we were able to work together. We would move into a steering group committee, talking about all the points that needed to be covered, and then reporting back to the large work group. Then we convened in September of 2012 as the whole large working group came to DC. And so we all worked together there, which was really important. And just the graphics here, thanks to Nancy, they're really cool. But that was the large working group, the continuing to work together in winter of 2012 to now. So that is the group and how we operated. The FaceTime was really important, the face-to-face. People had been talking to each other on the phone. Some people knew each other. Some people were colleagues in the group. So, and the group really consisted of program directors, the evaluators, people from academic institutions. So a real diverse group. And really building a relationship around that and coming up to a shared vision was important, and it was key. It was very collective and collaborative. Everyone was giving incredible insight into this effort from the experience they've had in their background working in the communities. And so we were able to do that and connect and really fostering that environment of exchanging ideas and a lot of brainstorming, a lot of creative brainstorming was had. And it was fluid. People were able to be on the calls and some weren't, but they would pick up whenever we had the next call. So it was really rich. I was really privileged to be on that, to experience all of that and learning a lot of lessons to be learned on evaluation. So that was our group and how we operated. It was a great experience, especially with such a large task, and then really exciting because this is probably one of the first frameworks to be developed for a tribal community. So we're going back to the roadmap. And
I think this big blank screen means it's my turn to talk. So we have a blank slide here for a very important reason. As Melinda said, the Children's Bureau wanted us to have this conversation, but they didn't give us really any guidance, except you need to do something. You need to do something that will improve practice in child welfare evaluation. And so that was at the same time, I think, very empowering to the work group and kind of overwhelming, but it really set the stage for having those conversations to brainstorm with the group about what does need to happen. And the conclusion we came to was that there is so much that needs to be done that really what needs to happen is some guidelines. We need a roadmap. We need a systematic, strategic plan for what needs to be done. We don't want to attack this by just saying, well, we can fix this over here or we can fix that over there, but really a vision for what evaluation practice should look like. So from our blank slate, we did this, and I'm having this scroll across slowly because I want to talk about this title, this name we gave to the thing that we came up with. And there's some important pieces, there's a lot of meaning in this title, and before we get to the actual roadmap, I just want to pause and think about those. The first piece of it is this word co-creating, and I stole this from a colleague of ours at Michigan State University, Hy Fitzgerald. Some of you may know Hy. He's very big on this idea and this image of co-creating, and it really captures what was happening in this group is that these different sorts of folks that came together, we were working together to create something as a group together, and the program folks and the professionals in the community working and the academic folks and the evaluators and the federal partners on the team, all of these different perspectives coming together to use the strengths and the resources from each of those perspectives and each of those individuals. The next piece is collaborative. So the co-creating is really about how the work group was coming up with this. Our vision for evaluation is that it really needs to be collaborative. And you'll see when we get to walking through the roadmap, it is all about collaboration among the different partners in evaluation and the different strengths that they bring. Another piece that's really important to us was the effectiveness. One of the problems, I think, with evaluation, sort of standard evaluation methods not working very well in tribal communities, is tribal communities then don't get effective evaluation. They don't get the solid evidence they need to be able to move forward and make changes in programs. So effectiveness is really critical. The tribal piece is just that recognition again that things are different in tribal communities. We need different practices. We need practices that are responsive to and accommodating of those particular cultural contexts in which this is happening. Improvement is just the idea that it is back to focusing on improving. That is our goal that we're keeping all along, is there's a reason for doing evaluation. It is to inform and improve practice. And we really saw all of these pieces as very interrelated, very much cycling back on one another and informing the different components of what we were doing as we tried to put this roadmap together. And one little piece up here, Tribal Child Welfare Programs is part of the title. It's part of the charge that we had, was to focus on evaluation in those programs. But we had a lot of discussion in the work group that these are very, we see the principles that we outline in the roadmap as having application to other child programs, but also to just any program in tribal communities, any evaluation, any research that's going on in tribal communities. We feel like these are principles that would serve to improve that practice all around. And now you're going to actually get to pick apart the roadmap.
We originally did not plan to do this tag team from this way. We were more kind of lateral instead of vertical, I guess. So thank you for your patience in allowing us to shift. So one of the things, again, we're going back to the end, moving towards to the beginning now. And one of the major communication issues that we had was, where do we begin? And we went a lot about starting from the middle, starting from the back. And we realized about, maybe a quarter of the way in, after several meetings, we can't have a true identification and a true product without acknowledging the history. And that acknowledgement of the history does not necessarily mean that we delve into and get stuck in the history, but we have to acknowledge the history. We have to acknowledge the intergenerational trauma. We have to acknowledge the distrust, because that's built upon many, many generations for many, many reasons. We have to identify and recognize the historical contents as it pertains to judgmental evaluations. Because again, we know that we are all products of our environment and our background, and unless you acknowledge, you are going to have judgmental pieces, because that's part of human nature also. In addition to that, we also have to acknowledge, and I'm trying very hard to find my slide here. Thank you. We also have to acknowledge the fact that the indigenous worldviews have been under-identified and under-valued because they have not been built upon. They have not been acknowledged. They have not been a part of the dialogue. They have not been a part of that baseline. So the historical context is really the baseline that we really, really struggled over, and we spent a lot of time. Again, we do not want to use this as well, that's because, or put in some endemic excuses for not being, how do I say, the results being good, so to speak, my words. But you have to have an acknowledgement as an outsider coming into Indian country, whether it's reservation-based or urban-based, to understand, as Nancy mentioned, there are endemic differences. There's language differences, there's cultural differences, there's approach differences. And that is part of that historical context. Just like anything else, we have to know our history before we move forward. This is also that baseline. One of the other areas within the conversation and discussion we had in identifying the historical context is how does this relate to looking as it is today and going backwards? And I mean by that is how do we move from how we practice today as a researcher, as an evaluator, and how do we learn to look at that cultural context within the historical perspective? So we're going to talk a little bit about that also later on in the presentation when we bring all of these together into a blended, woven piece.
Thanks, Nancy. So within that historical context setting and acknowledging the history, we also talked about values and how values were really critical to our communities, and that's a big difference to acknowledge with research and evaluation as it is today. So we brainstormed and everybody talked about indigenous ways of knowing, really acknowledging that as an evaluation component in tribal communities, because every community, tribal, otherwise, around the world, people always do evaluation every day of what they're doing in their lives, whether it's hunting, looking for hunting grounds, during the seasons, what to harvest and when. All of that is evaluation, and that's what we talked about for indigenous ways of knowing. And then we talked about respect for tribal sovereignty. That's a critical component. So that was another issue that we included in developing our values for the framework. We also talked about the strengths focus. We always hear about all the problems whenever we talk about tribal communities. Everything is in the negative. So we felt it was important as a group to really focus on strengths that communities have and starting from there, working with strengths and having the communities acknowledge their strengths, because many times they've been told that there's problems. I mean, even today, there's another article in New York Times about Pine Ridge and how the sequestration is affecting them. So it's all of those types of information that communities get, and after a while, there's just that, they're adding to the sense of the hopelessness that's already there. So we thought it was important to bring in that strengths focus. And then we talked about the cultural and scientific rigor. I think it was important to bring that up because we have our ideas about what rigor is, and really about including the cultural aspect of our communities to be part of that rigor. Because when I mentioned before about having done evaluation as tribal communities from way back before and even today, we deserve to have something that is rigorous, that's going to be beneficial for our communities, that's going to tell us how effective our programs are and how well they're working in our communities. So we talked about that. That was an important piece of our values. And community engagement, really working with the community together, not just developing something as a group of experts. So we really thought that community engagement is another critical piece, because everybody has something to contribute, whether they're a community volunteer, an elder, youth. I think it's important to consider everyone in the community to be engaged in this process. And then we talked about ethical practices that with our tribal communities, there are ethical practices in their culture built in, and using professional ethical practices, whether it's for psychology or social work or being an MD, a doctor. Everyone has ethical practices, and so our communities do as well. So we wanted to include that. And also knowledge sharing. Really sharing everything that we know about evaluation, about data collection, of the processes that go into evaluation, and really sharing that. So then we talk about stakeholders in this whole roadmap. We brainstormed to include everyone that would have an interest in doing evaluation in tribal communities, and how it impacts everyone in the community that runs a program or is thinking about developing a program, and where it starts with policymakers, with program directors, with the tribal government. These are all important people who contribute to evaluation in some aspect of it. The universities, professional organizations. So we included as many people who would be affected by it and had an impact, and evaluation impacts them as well. So we tried to list everyone there, and that's the stakeholder group. And then within the roadmap or the framework, we talked about how relationship building is a really big piece in that. You need to have that going into these communities and working in a larger community of universities or professional organizations. We need to set some relationship building, and it needs to be bi-directional. I think that the community has something to offer, as well as the people who are doing the evaluation. So we talked about the practice and how it involves the communities determining their own priorities. What do they want to evaluate? And really talking about what types of cultural and ethical practices that are there that are going to be part of the evaluation process, and dialoguing with the community about those things, and really establishing clear guidelines and examples of evaluation components that are important to the community. Guidelines and examples that are required, that are tied to funding. I mean, there needs to be some of that balance in there. And really having some transparency in doing that, the evaluation and the process, and really helping the community to know what that means. And we also talked about developing policies and establishing clear guidelines and building tribal infrastructure for evaluation, because it needs to come from that community, working together, develop that to have real meaningful impacts in the community. And so that's the relationship building piece in the roadmap. And I will hand it over to Nancy R. Nancer.
So the other side of the building relationships that we talked a lot about was building knowledge and skills. And we really saw that both of those pieces really kind of needed to be in balance, which is why when you see the full roadmap, they're sort of equally sized, equally located within the framework. And Carlette mentioned bidirectional. We talked a lot about bidirectional knowledge and bidirectional skill building here. And you'll see that some of these things that we have listed are really things that we need communities to teach outside researchers and outside evaluators. For example, cultural protocols for community-engaged comprehensive evaluation. That's something that needs to come from the community. Community needs to be empowered to say to researchers or evaluators coming in, this is how you do things in our community. This is what works. This is how you do effective evaluation in the community. From the other side, there are a lot of opportunities we see for people who have training in research and evaluation to share those skills and teach those methods to people in the community who are on the ground doing evaluation and need a little more expertise in how to make that happen. So we talked a lot about opportunities for mentoring, not just classes, not just books, but opportunities. And this kind of goes back to how intertwined the relationship building is with the knowledge and skills building, is kind of building relationships that allow for that mentorship to happen. Another thing we talked about was providing guidelines for selecting, adapting, developing, administering, and interpreting evaluation instruments. It's a confusing world out there when you're trying to find the right instrument for what you want to measure in your community. And we talked about one thing that could really move things forward was providing more resources, more guidelines for how to figure out what to use. For those of you in the class that heard the presentation this morning, what's been used in American Indian and Alaska Native communities, what's been found effective, just some help, some resources there. Another thing we talked a lot about in the work group was this bullet that says storytelling to support staff in community interpretation of evaluation data started out saying dissemination, and it evolved over time with the idea that dissemination is a researchery word, and dissemination in a lot of the formats that we use in academic and evaluation circles doesn't ever land where it can be useful, or doesn't land in a format that can be useful in tribal communities. And we talked a lot about storytelling and narrative and making the results of studies coming back to communities in a way that's a conversation, or that's a story, or that's useful, that really does have the impact, brings that information back and makes it useful to improve programs. We also talked about knowledge and skills building in terms of training in the use, interpretation, and storage of data. So you have this data, you found the right measures, you collect all this information, and then what happens? Does it sit on a shelf, or are there people in the programs who say, I know what to do with that, I know how to use that data, I know how to make sense of it, I know how to use it to answer the questions. And then the storage of data piece is just the idea of hanging on to it. So if you have a question to ask of it later, can you access that information? Another thing that came up a lot was this consolidation and coordination of data across community programs. And there was a lot of conversations about how this program's getting this data, that program's getting that data, and we don't really, those systems don't talk to one another. And so some skills building around how can you get a sort of centralized data bank or something in the community that allows, you know, the Head Start program to maybe access data childcare has collected that can be informative in their programs. So that's another thing we saw as a key priority in moving things forward. And then I'll just note that one little box at the bottom, Carlette mentioned it in relationship building, and you'll see it's sort of shady colored towards the relationship side. And that one flip-flopped back and forth, and we had a very hard time actually with a lot of these, deciding whether they were really about the relationship or about the skills, because again, we see those as very intertwined. This one particularly though, because developing those policies and establishing those guidelines, we were discussing that in terms of it really takes that conversation between the researchers, evaluators, and the community about how do you decide what those policies should be that would be appropriately protect the community and the tribal sovereignty and all of those kinds of issues, but at the same time meet the guidelines of institutional review boards and established policies and the lessons that have been learned in academic research and in evaluation. And also just that infrastructure building. So it's one thing to say tribes should have governance of how these things work in the community. It's another thing to find the people in the communities who understand and have the time and have the resources to be able to take on that role. So trying to figure out how to help build that infrastructure, I think, is a critical next step in moving evaluation forward. And then I think we're going to all kind of try to chime in on this last piece. This sort of egg in the middle of the narrative is really the end point, is really bringing it all back together. And we had a lot of discussion here, again, about what do we call this vision? And it really is building a new narrative for how we see evaluation practice being most effective in tribal communities. And we're going to do a little back and forth, and I think Carlette's taken the first word here.
Okay, so we talked about the collaborative and the culturally responsive evaluation. And the collaborative piece was really what was important for evaluators to talk about in our group, that we're not just doing this one-sided, but that we're doing it collaboratively with the community. And so we really had that representation of folks in the stakeholder group, and that's the collaborative piece. The culturally responsive piece was really talking about some of the programs in tribal communities that do cultural things. For example, in my community, we have a child welfare agency that has a practice model that's based on cultural values and practices of child rearing. We also do a lot of ceremonies to address mental health issues. And so really looking at those types of issues as culturally responsive evaluation. And then the bidirectional learning, again, going by working with the community, really learning from them as well as teaching the community, but that give and take of both learning from the community, because they live in those communities, they know who they are, they know their culture, and so they will be able to teach the evaluators as well. So it's the bidirectional learning piece.
Looking at the building a new narrative also is the systems improvement. That is one of the goals, is to improve the system, but recognizing that we can't improve one system without impacting the other. So I think some of the challenge of really implementing this and really starting the new dialogue and starting the new narrative is, how do we grow together? Those of us who have worked and continue to work in tribal programs know that there is a certain anxiety when we have to face and welcome a program evaluation. And that anxiety is both driven externally from having people come to evaluate your program, and also internally from your tribal governments, your tribal communities, your parents, your elders, to say, okay, how are you going to respond to this? So this all results in anxiety from both sides, but it's also an opportunity to really look at systemic change. And how do we change and use that energy, because there is energy that does come from anxiety, to really start moving towards the new narrative, the new way of looking at it, of engaging rather than a giving. It's a giving and taking this way. So that's going to be a challenge of looking at the systemic changes, the improvements. For tribal communities and tribal providers and practitioners, it's also going to mean educating the governmental components, educating the elders, educating the community, educating the parents, and also educating your staff. Because as we mentioned in the historical context, some of us, that is not 300 years ago. That may be last week. Some of those historical issues are constantly in play. So how are we going to use what we know, build on what we know as solid foundations of values to really, really use that energy and that anxiety to change systems, to change thinking, to change action, and to change words? Because words are what guides us. So that's going to be a challenge, especially for tribal practitioners. It's also going to be a challenge for the evaluators, because many have not had the opportunity to work and engage with the community in Indian country, whether it be reservation-based or urban-based. That is something you can project because they're within their circle of comfort. But when they're within a community, they may be outside of that circle of comfort. So again, that systemic change is a lateral, it's a bilateral, but it's also very much systemic on both sides, kind of at the same time. The other thing that that part of this narrative is critical is, what are the local questions? Not only identifying local questions, but how do you develop the local questions and who develops them? If we are looking for a community approach, we are also looking at, within our systems change, how do we engage the community more within our programs? How do we engage the communities more in the whole cycle of programs? Not just if it's childcare, the classroom, the daytime, the daycare, the Head Start, the ICW, the elders programs, the Title VI, AOA programs, all of these programs. How do we develop the questions to be able to then create a foundation to move forward into the evaluation? That is also going to be a different approach of looking at it community-wise. And always, if you are reservation-based, you have the added level of your elected officials. And how do you engage your government? Or if you're urban, your boards of directors and your elders to participate in this process, to teach that it is critical in the importance of leading through dialogue. And that's a different thing for different places, which is also critical. Data. Data is as my colleagues mentioned, we had a lot of conversations around data. And you know, we have, as we all know, very sophisticated tribal governments and urban organizations that have systems and have resources. And then we have very small tribal communities that their data is going to look very, very different. In that, you are not going to be able to run it off of a computer. It may be held on a ledger. It may be handwritten notations. It may be hand calculated. Is it less valuable? No. But evaluators and researchers need to be flexible enough to recognize the value of that data, regardless of the presentation of the data, is as significant. And how do you use that? How do you incorporate that? And how do you bring that in its best way? And again, the last part is the insight. And each party has their insights. The evaluation has an insight that can help us to corral our thoughts and corral our process. Because again, if you're a tribal practitioner or a tribal employee, you know that you go in 83,000 directions and you may not have the luxury of working with one program. That outside evaluator or researcher can help you to focus as well, help your community focus as well. So the process of insights, and the insight that the community has is vast and deep because of not just the historical perspective, but also because of the practical perspective. Our tribal communities, whether they be urban or whether they be reservation-based, are microcosms of society in general. And often they are not looked upon that way, but they can be a valuable tool if we look at engagement and if we look at this collaborative model as a beginning point. But again, that new narrative is basically the old ways of doing things. This is really not that new. So we begin at the end and we move forward by going back. And now we'll move into our next step.
So I'm going to talk about just the last 2 points that describe our new narrative. One being meaningful analysis. Again, this is something we had a lot of discussion about, is we can do a big fancy study and we can answer all these questions and we can come back with analyses that really don't mean much in the community. A lot of the meaning in analysis, I think, derives from the point just above this, that's guided by local questions and local data and local insights. And then we can come back with analyses that provide some answers that have local relevance and meaning. So it's part of that whole picture of how, as the work group, we envisioned this should look. And then the last point at the bottom where it says AIA and evaluation skills, American Indian, Alaska Native individuals in communities who have the skills to do the rigorous scientific research and evaluation, but also bring with them the skills to contribute the cultural rigor piece and are able to bridge that gap and merge those two very valuable agendas together, I think is really, really critical to moving this forward. And we talked a lot about the different relative strengths that all of those stakeholders surrounding this bring to the equation. And there was a great deal of discussion of the value of all of those different perspectives, but I think there's also a great deal of recognition that there is a really critical bridge that can be formed by having people in the communities with the cultural background also being able to talk the talk of research and be able to bridge that gap. So finding ways to make that more a part of what the evaluation narrative looks like is a priority. So if we put this all together now, we have the whole narrative. And I just wanted to say a few things about the way this is arranged, because we didn't just come up with lists of things and priorities and throw them randomly into this circle. There's a lot of meaning in the way this was put together. For one thing, the circles themselves was an important image that the work group members felt like we needed to carry through this. The second is sort of the order we've presented these things and the way these have been pieced together are meaningful. So the historical context being the background that informs this, but also what the new narrative is designed to sort of move beyond. So acknowledging that context, recognizing how that colors and flavors the way evaluation is done, but moving on. The values being the next layer, that those values in putting together this roadmap are critical and very intentional. And that everything that's the layers above that all rest on those values and that perspective in moving forward. The stakeholders around the edge is the recognition that all of those groups are interacting and owning this new narrative that is within the center of this model. They all play really important roles. We're going to be giving you later a draft that is a little more detailed than what we're discussing. It's pages and pages long. But one of the things we talk about, this is the narrative that goes with our roadmap, is how each of those stakeholders is involved in addressing each of these priorities in the relationship building and the knowledge and skill building, what each of those stakeholders brings to addressing those priorities, and how each of those stakeholders is benefited by addressing those priorities. So professional organizations can help in the training and use and interpretation of data. Professional organizations can benefit from cultural protocols for community engaged comprehensive. There's learning to be done both ways. It goes back to that bidirectionality. So we did a lot of time thinking and talking about what are all the roles that everyone plays in this process. And then you'll notice with the relationship building and knowledge and skill building priorities, they all point into that center of the new narrative, because we see each of those components as really critical towards crafting that new narrative, building that new narrative, and taking evaluation practice to the place that, at least in our vision, it should be. And one of the things we love feedback on is, what do you think of this vision? Does it seem, right? And we have some very specific questions to ask about your reflections on this, and also we just love general reflections. But the whole visual of this was very carefully crafted to reflect the values and the priorities of the work group as we went through. And we will let everyone take this full narrative and also a copy of this roadmap away with you to reflect on and sort of digest and think through. Do either of you have any other comments on the whole thing before we move on to questions, or?
I just had one, the building your own concept.
Oh yeah, that's something that didn't really get reflected in this presentation, and we talked about a lot, was the idea of growing our own. The road, and maybe someone else should talk about this actually, because growing our own doesn't make as much sense coming from me. But you want to kind of explain that value, that concept?
Yeah, in here somewhere, or in the narrative itself, we talked a lot about building our own in our communities, just as you may be doing that at this moment by being in this institute, but really growing our own local community evaluators to do the work. That was really another important piece of values that we wanted to include and have as part of this whole framework.
So would love to hear folks' just initial responses, reflections, thoughts about the narrative, rewriting the narrative, the roadmap.
And if anyone has questions, we're going to give you mics so that you can be heard on the audio as well.
Patty? Because you're brave.
Okay, great. I'm brave, she says. I think that this is really well thought out, number one. I appreciate hearing this and seeing this, and what I'd like to know is how you see this being used. Is this something that's going to go to ACF, to different federal organizations as a recommendation?
Brian?
Hi, I'm Brian Deakins. I'm from the Children's
He's the
Bureau.
boss.
I'm kind of overseeing a couple of these different things. So the first place that the framework will sit is on the Children's Bureau website, and it will be, we're hoping that it's right next to the video of this presentation so that people have access to that. And then we've also been thinking about trying to create short video, little video clips that are like 8 minutes long that cover different aspects of the framework, kind of like a TED Talk or a YouTube video that would be able to share a little bit of more information about the framework as well. So that, including the narrative, will all be sitting on the CB website that you have, so that people have access to them.
So are you going to be specific to your audience in terms of who you're going to share this with? I can see that this could benefit the National Centers of Excellence in the way that they prepare their materials to include tribal perspective and cultural respect.
Yeah, as you heard the work group talk about a little bit, this was initially, this came out of a request from the Children's Bureau to really think about evaluation in tribal communities and that impact potentially on child welfare programs. But I think as you heard, as the work group really thought through its applicability, they believed that it was really going to be relevant to a number of different areas, including early childhood, et cetera. And so I think that right now we're at a place where we know how we will be able to reach out and to share this with folks in child welfare, because that's where we, in terms of the Children's Bureau, is sitting. But that we're really looking for thoughts and ideas about where else this should go, where else it can be shared with folks, and any suggestions that you folks have as well about where you feel like this would be relevant or how it could be used would be helpful information to this group, and I'll let other folks on the panel respond.
For example, I'm certainly, once it's ready for public consumption, going to be sharing it with all of the Office of Planning, Research, and Evaluation and say, check this out. And we have a presentation at the American Evaluation Association in October where this process is, so it's going to be shared there. And so I have lots of little plans, personally.
We had a lot of discussion about this very issue in the work group, and people would say from time to time, well, can we send this to, the program officers at NIH? Can we send this to the, SAMHSA? Can we send it to CDC? So I think there was a lot of discussion about people in programs with funding and evaluation saying, I want to hold this up and say, this is how it needs to be done in my community, and have something to refer to, something concrete that they could be able to do. And we talked about what are the strategies for disseminating it to those audiences, and in the stakeholder groups that we have here, the ones across the top are really what we saw as the primary stakeholder. It was kind of in line with Children's Bureau's original goal for this work group, and so getting it out to those groups first is the priority, and getting that kind of feedback. Who needs to be the secondary stakeholders? Who do we go to next with this information to try to establish it as standard practice, I think is.
Right, and I think, we had a lot of in-depth conversation as to where does this go? Is this going to be another product that's just going to sit? Because we've seen that in the past. And I think, from the tribal side, it's our challenge also that when we have evaluations, whether it is Head Start or Early Head Start, or whether it is SAMHSA, or whether it is AOA in Title VI, that we bring this up also to the administrations and say, this is a model of evaluation that I would like to discuss and participate and have as our process for evaluation. So it's not just on the onerous of the federal evaluators or the federal programs, but it's also on the onerous of the tribal, and how do we get this information out to the tribals? So I think that is also a real key piece of moving this from the dialogue into practice, into that newness.
Yes.
Is it on?
Yes.
Okay. So I'm looking at this document and I'm really kind of thrilled, but I'm also wondering where it was as I began the home visiting process. I'm thinking if my tribal community was here and vested in this document, how much easier my job would have been over the last 3 months. So I applaud you in doing this because I've felt a little bit lost as I've gone through the process, and I think if we all get to this place where you all have come from and are now, and we all are vested in it, I just think we can move mountains.
Yeah, there's some parallel processes going on.
I might just add a little bit to what she was saying. I really responded, well, I think I did anyway, to what you're saying about move forward by going back. Because I think within us, for those people that work in varying capacities within tribal communities, we have an idea about what works, right? Just within us. And so yeah, I thought you all did a beautiful job of putting it on paper and putting it in a diagram that really, with the explanation that you gave, works for me and feels, yeah, that was there, that was there. And so I'm wondering too, when you do disseminate it, how you are going to explain, like you did for us, to other people. In what way is that going to happen?
You mean the unfolding, kind of the genius behind Nancy PowerPoints, the way she
And
That's
don't
part of
get
the video.
Nancy's mixed up. This is the queen of the PowerPoints and the technical piece.
I'm a scribe.
Yeah, and I am not. So.
But I think that is part of what we realized as we were talking about rolling this out, that if we could have a place where people could kind of, so that's part of the video short idea. I don't know if we can get kind of one of those little books that you flip the pages and new parts come on, like a children's book.
Yeah. Well, hopefully in the digital storytelling folks who put together these digital shorts will be able to capture that unfolding in 8 minutes or less, right? That's their challenge.
So what, was there anything in particular that's, when you go, yeah, when that was explained in that way, or?
Well, I was actually thinking about an example. I don't know if it's appropriate for here, but I'll just say it anyway. Somebody asked me, was doing like an informant interview about a project that we did, that asked me about CBPR. And they asked, well, how does that come about in your community? How do people talk about that? And I said, well, we don't, because we talk about how things are supposed to be. We don't use those words. And so that's what I thought when I heard your presentation. You put on paper what we know. And so all I was thinking was, in terms of my question about how you're going to be presenting it, was, okay, if I had something, even a one page that said, step number 1, take a look at the outside circle. This is what it means. That would be very helpful. Step number 2, just like you did.
Yeah, I think part of that we tried to do in that thick narrative that you have. And we had a sort of a vision for the narrative that it could eventually be something where you get this and you want to know about this, so you click on it and you get it expanded. And you click on this, and there's some technical issues in trying to make that happen, but I think that's one vision of how that document, I don't know if it's a document that does that, but something like that could work so that you could see the pieces. And in the narrative, we sort of walk through the pieces, kind of like we did here today, but in much more detail. But one of the things we really struggled with was what's the order for that, because this is not a linear model, and we had to put it down in a linear document. And it feels very, we went back and forth. Some things would be at the beginning and then the end, and then they, it's like, where do you start? So some kind of interactive unfolding, I think, is what we would like to see, but I don't really know.
Hi.
Hi.
Am I close to it? Is it on? Okay.
Okay.
So a couple questions, thoughts. One is, when you're saying tribal child welfare, what do you mean by tribal? Because, I'm enrolled in a tribe, but I don't consider myself tribal because I live in an urban environment. So how is this going to translate to our urban population? As the last census said, over 60% of our population tribes do not live on reservations. So how can this be translated? How can I take this back to my urban community that is made up of, well over 200 different types of tribal people, and say, look what I have, let's get going, let's work on this.
Right.
So I guess a question and then a comment that I had.
Well, I think that's a really good question. When we were working as the group, that was definitely an issue. And I think because of the way the framework was developed, that it would be able to be used in different community settings, whether it was urban or reservation. And whether it was for child welfare or for another program. So it was basically started out that way because it's from the Children's Bureau, but we were trying to address all the different factors that the American Indian, Alaska Native communities live.
So I think that makes me think that needs to be right at the front, is that the word tribal is being used to be very inclusive, because we wouldn't want it. It was intended. We want it to be inclusive, and so we may have to specify that.
Yeah, that would be
As we
great,
communicate it.
because, anywhere I go, I always have to say, well, I'm not representing a tribe.
Right.
I'm an urban
Right.
organization representing people from many tribes, so I always have to throw that out there.
And we really did have a conversation about that at the very beginning. Is this, are we talking about the Indian community, or are we talking about the tribal community? Because as Lynette said, those two words have very different connotations and definitions or environments really around them. So I think that, thank you for bringing that up, because I think that's very important. Going back to the sacredness of words and the importance of words and how we really utilize them. I think the other thing too, Lynette, that you brought up is the fact that there may be a different community that resides within the urban areas, but I think the essence of the Indian community has a lot of similarities and a lot of cohesiveness, whether it's reservation-based or urban-based. I think we all know many of our urban relatives that live, but there is a subculture and a sub-community within that urban area, whether it be Seattle or San Francisco or LA or Boston or New York. There's these subsets of communities. I think the challenge to us to move this dialogue forward is also a similar challenge that we're going to have on reservation-based, and that's going to be, it's going to take time to change the view and to change the language of our communities, regardless of whether it's reservation or urban-based, to accept this. And many of our funding sources are very time-specific. So you have, you're kind of fighting against the clock at the same time of redeveloping and identifying a new model. So, that challenge is going to be unique to both urban and reservation-based. I think in the urban structure, and I know the Seattle community, so I know the resources there. But you can really look at how can you bring each of these variant communities together, whether it be the school community, the Head Start community, the health community, the elder community, and all of those in addition to other communities that we may not even be aware of at this point. So that's going to be a challenge. On the reservation, it's going to be a challenge to bring all of these communities and these parts of the community together to start it at the same time of dealing with an imposed timeline that may be a resource or a funding issue that you are also balancing to establish change and establish a systemic change that's going to last after we leave. So I don't know if that was helpful or not, Lynette, but there is a very clear similarity. When you were talking community and not necessarily reservation, that was the other thing, is we were really, really important to mention and build this around a community. And community may exist in very different ways all across the country.
So this, one question we wanted to hear from you all about was, have you had experience where you've had evaluation led by local questions? Like questions that so that historical context of the kind of intrusive imposed evaluation. Have you had experiences with that, and would the roadmap as up there, does that kind of capture some of the things that were surrounding research that was driven by local questions? Cindy?
With the RPG grant that White Earth was a part of for 5 years, there was a very prescriptive, rigid evaluation component that made up that program. And so we did that, but within that was the opportunity for local evaluation, and actually an obligation to have locally developed without a lot of guidelines as to what that meant. And so White Earth did that, and actually out of the whole 5-year process, the most exciting data that we have is around that local tool that was developed that looks at culture and a variety of other things. And I mean, the data is very exciting, and White Earth has been asked to present on those findings a couple of different times. When I saw this information, I got very excited about it, and I think that it reflects how that process, I think I said in the thought question the other day, even about community-based participatory research, the community's never called it that, but it's been doing that for a long, long time, and this is validating, I think, of that, which feels really, really good. One of the things that I would hope, too, is that it goes to the funding level, and so that even within RFPs and things, that it's reflected that this has value and is recognized as valid and appropriate within the community. And so that's one of the ways to help operationalize it, I think, across the country, is to be able to see that connection and acknowledgement at that level. But I would say, back to your original question, we did go through that process. It came from community assessment, it came from talking to people, it came from getting approval of the document. And that's so, even if we weren't entirely sure what the path was that we were going, the community drove how that was developed. And some very insightful staff were key in making that happen as well. So, I mean, I see things in here, and I think, I can relate the experiences of that process, and also the home visiting process and other programs that are being evaluated. But this could be potentially a template or a framework that helps inform how that's done, but recognizes that when you write about tribal ways of knowing or indigenous ways of knowing, that it's going to be acknowledged and supported and respected, as opposed to a concept a reviewer might not understand. So I just saw that as very promising and exciting. And I can't wait.
Education, right?
And I can't wait to read the whole thing.
So you need a microphone before you can do that.
I'm looking at the graphic, and it's so large and all inclusive, and I'm wondering, when you're going through the process of applying it and using it, is there any variation in, or is any area weighted more than another to create a clear, path or evaluation of a community, or do they make that decision as they're going through the process? Because it seems like a very, it's holistic and progressive and has a lot of components. So I'm just wondering, along the way, is any component weighted more than others, and does the user make that decision?
I would think, I completely agree, this is not all going to happen immediately. This is a lot in here. It's really the big, broad vision of where things should go. And I do think it's got to be what could you tackle? A lot of times we talk about what's the low-hanging fruit. You need to start somewhere. Let's start with the easier things, maybe. What seems easier to accomplish in your community? Make those incremental improvements in how practice happens, and some would be longer term. Getting having fully trained research staff in the community who can do this from the ground up is a time-consuming process. Which may even involve encouraging high school students to consider going on to college and research. There's all kinds of long-term, short-term pieces inherent in here, but I think it's got to be what fits and what seems most urgent, and
I think the urgent part could maybe be figured. One of the things that's inside the picture but not visual is that we talked a lot about damaged relationships and lack of knowledge and skill, and that those two things were what was driving the bad narrative. And so thinking about your community, it might be, or an individual community, is where are our relationships and where are our skill sets around this thing, and what needs most building? And I guess that might be the way of thinking about it. That might be a way of approaching the prioritization, is to be thinking about that, because we decided not to put those in here, but those two big areas came, and we said, well, let's flip those, because those are both things we can change. We can't change the historical context, but we can change people's skill sets and their relationships.
And actually, that is a point that we talked a lot. We started in this with saying people are afraid, in tribal communities, people are afraid of the evaluation process. And they're afraid of the being evaluated part, and they're afraid because they don't know what to do sometimes. It's like, I'm being asked to do this, and I don't even know where to start. And there was really a lot of conversation about, we don't want to focus on that fear. We want to focus on what's necessary to address those fears. And the relationship building being an important part of it, trusting that evaluation is being done for good reasons, that it's not a judgmental thing, those kinds of pieces. And the knowledge and skill building to address the I don't know what to do fear. I don't have an experience in this, I don't know what to do. And I think it's back to that focus on strengths, focus on positive, focus on moving forward and what can be accomplished rather than what are the problems. And we didn't really address that in this presentation at all, but there's more discussion of that in the narrative too. That I think is a really important point of how we got to where we are with this.
Well, I'm Jocelyn, and I'm coming as a community member and a concerned citizen. And so when we're talking about, the research and evaluation, I'm kind of in the dark about it, but I have this information and it's really valuable, especially with what we're learning in the Institute. But my question would be is, where would you ideally want this to land first in a tribal community? Because right now, I know as of last week, we were at the Tribal Council, and our Navajo Nation has a tribal IRB. But one of our institutions, Navajo Technical University, actually got their legislation through and was approved to create their own IRB. And so now when I'm, kind of gaining this knowledge and looking around, I'm like, okay, I want to take this back, but I want to take it back and give it to someone who will actually value it and not say, oh, no, that looks great, thank you, and put it with the other stack. So for you as the creators, where would you really want this to land and go? Because that would be a first step for me, and, just to get your work into working hands.
I think, I'll take a stab at that. I think working in child welfare myself in the past, There are a lot of child welfare program directors who are doing some work with cultural practices. And so, speaking for the community that I come from, they are doing some work in child rearing, addressing mental health issues for families in more cultural ways. I would want to look at how those things are going to be working in the future. So I would look at that, maybe program directors that are interested in evaluating what's working for them. So personally, that's where I would look, ideally, where I'm coming from.
I think also, obviously, knowledge of your tribal government system, and some tribes will have committees for programs and departments. That may be a starting point. Other tribes may have planning departments that do all of the writing for grants and stuff. It would be really critical to involve your planning department, because every grant now has an evaluation component. This could be written into the application. This is how I am going to, or we are going to be addressing our evaluation component. So that is endemic to the application, but it also holds each body, the recipient as well as the funder, to the same expectations, because it's a grant that has been accepted. So again, depending upon your structure within your government, that could be a key point. The other, again, for some tribes, you may go directly to your governing body and say, this is how we would like to move towards evaluation, and get your governing bodies sign off, because the word research in Indian country still is a little bit uncomfortable for a lot of our members, and especially a lot of our leaders. So depending again upon how your tribal government functions, or your urban centers function, that is going to be something that's really, really important to look at. So each starting point is going to be different, depending upon your makeup within your organization. But I would strongly encourage, if your tribe does have a planning department or a group that does do your writing, that is really, really a critical piece. If your departments do their own writing in response to RFPs, have your directors meet or have your writers meet together, because that's one way to really start a uniform approach tribally, to say this is for, regardless of whether it's going to be a Title VI or an ICW or a child care or a Head Start or a SAMHSA grant. It's something that could be written across the board. This is our evaluation piece, and this is how we want to approach that. And it keeps both of us accountable to the same end. Tribal colleges, if you have them close by.
And Doug had we've got lots of comments. This is great.
This is wonderful. It really has a great feeling to it. It clearly has a lot of really experience and wisdom built into it, and raises a lot of important issues. As I look at it, I feel like there's something missing that hadn't really occurred to me until I had to see all of you sitting up there and thought about it a little bit more. I feel like and having thought also, Carlette, about that editorial today in the New York Times and the critical role of the federal sequestration, the impacts it's having on tribal communities. And I feel like that's the piece that maybe isn't here that needs to be talked about, which is the federal role in this. The focus here is largely on tribes and on universities. Policymakers are here a little bit. There's around a little bit on funding guidelines, but honestly, the only reason this is happening is because the federal government made it happen. The only reason a lot of this research and evaluation is happening in tribal communities is because the federal government has mandated evaluations and programs in order to get funding. And for this to have any force, it's really going to require a strong federal effort to make it happen. So I'm wondering how you think we should be thinking about that.
Brian and I have talked about this. And Melinda. Like, that's quite a challenge to, because I had said, well, why don't we just have them write what we should put in our FOAs? And Brian said, I don't think we can really do that, Alita. And so how to, wow, I don't have an answer to that, so why am I talking?
I may be way out of line here, but it's not unusual for me to be out of line, so I'm going to be anyhow. But one of the things that under the president's guidance, as well as under his leadership, was really to strengthen the consultation process, throughout the federal government, in a government to government with the individual tribal governments. Because of that, and also through NCAI and National Congress of American Indians and other groups, there is now an advisory committee made up of tribal leaders to the Secretary of HHS specifically, and they meet and they're very, very active. In addition to that, there is also an Indian advisory to the Commissioner for ACF in each of these areas. One of the things that we may want to consider is a presentation to both of these advisory committees as to what this group has come up with to guide research and data collection specifically in Indian country, as well as a new narrative around evaluation, not as a punitive punishment, but as a systemic, as a way to change our systems and look at systemic change in a very healthy way. I mean, these are very, very clear ways that we can, because that has been, Doug, a huge question on my plate and many of ours, throughout the whole process. This is really critical work that all of us, we all participate in every day. And there are avenues to value this and to develop this and entrench it almost into the federal system as well as the tribal system, and it will bleed over into the state system because we also have a state relationship with our tribes. So that's an idea. I don't know if we can fulfill it, but that's an idea.
If we have some audiences.
That was actually going to be a part of my point. Is getting to those kind of systems that many of us, I think, in tribal government feel very overwhelmed, on a regular basis, but see the dire need to really change those systems. I just also wanted to reiterate, some of the other thoughts that I heard. I think the community-based planning effort is always. I think we've done a good job in our community to just do it and to have other folks who come into our environments do it. But I think where we've been left out is, and where I think we struggle still to this day is with agencies that are doing the work and we have no idea that they're doing the work. And how do we become involved in that? And that's where I sort of go to, there's got to be some kind of effort made to require those agencies, and I hate those terms, to require somebody to do something, but unfortunately that's just where we stand as a tribal community is sort of always playing that catch up to what another agency is doing. The other point I wanted to make here or to really ask is whether or not the group considered the Indian Health Service systems in the stakeholder group. I didn't see them really, I think, called out in it, but I think one of the kind of common in Indian country, what I've heard, especially locally, is is tribes really playing an integral role in the healthcare systems and their evaluation processes. While many of us may be consortiums, we're sort of struggling with, many of us are newer government systems, especially in California, given our history in California becoming tribal governments. But also, these Indian healthcare systems are fairly new, and they're getting better, but somehow we're not working cohesively, because we're creating big governments, they're creating big structures, so somehow we need to kind of bridge that. But overall, I think this document is excellent, and I really sincerely want all of the people who worked so hard on this, because I know, especially in child welfare, that everybody is so overtapped, that I would really encourage folks who work for the agencies to take it to the next level, because I think, in any country we're always being overtapped and never feel like, it's ever going anywhere, and that the real policy decision and those policy decision makers, are never really just, pushing us over to that next level. So, but thank you. I can see a lot of hard work.
Hi. I'm going to be looking at my notes on my iPhone that I made because I wanted to make a couple of points. The first of which I'm not sure if it's a good thing or a bad thing necessarily, but I found it interesting that child is only in the title of the picture, given that this is a Children's Bureau focus in the child welfare. And I think that sometimes when we think about our work and working with children, they're at the center of what we're doing. And I recognize it in the title, but not in the image. But I also think that's a positive thing in that you can use this image to work with other agencies and organizations. So just a quick comment on that. Next is that I know how difficult it is to come up with a visual image that represents all your thoughts. So I really appreciate the hard work that went into getting an image that is clear and easy to understand without having, I know that there's a lot more that you've written up to explain this image, but I really appreciate the ease at which it is, to understand this. It's really quick to look at and get an understanding of what you wanted to accomplish. And also with all the different bodies that you were incorporating ideas from. I know that's really hard to do. One comment to go back to the idea about the urban population, I think that it came across again in the narrative as you were discussing it. Nancy, I believe you mentioned community boards or advisory boards or something to that effect. So I know that in other documents I've seen created for tribes, if there's not an immediate recognition that they're represented in the image, it's not valid and important, and there's not a lot of, it may not be taken as being important.
Right.
So to have that population represented clearly in a visual is really important, and I don't know where you were expecting that they would fall within one of those stakeholder boxes. Because if it were the program director's side, I don't know if that's appropriate, but they're at the top, and that's at a different level than the tribal government. So just some things to think about, maybe putting them somewhere on that stakeholder list. And then last, or two more points. I am a student, so I'm a doctor of public health candidate here at Hopkins, and I think the building your own is really important. And I've been in institutions where there isn't a lot of work with tribal communities, or the work that is done is very limited. So I really appreciate, and I feel like I could use this very easily in talking with some of my faculty members and people that I work with to say, this is what I mean in one quick image, instead of having to constantly go back and explain what I'm talking about and why it's so important to include tribal perspectives and indigenous knowledge in what we do. And then last, as someone who considers myself a researcher sort of first and evaluator second, I think that I could very easily see research being in place of evaluation in each place in this model, and use it for research perspectives as well, especially in thinking about working at a level with NIH and doing research at the NIH level. I think that this is something they've talked about consultation a lot within NIH recently, and having this as a basis to work from would be really important. So thank you guys for your work.
Can I ask you a question? So, sounds to me like the way you were talking about child, that if a value was healthy development or something about humans growing over time, that part of what this is to, and we talked about this, and that might be the place to put it, would be in that values. And then I was thinking about, it made me think of citizenship. There was something that we were talking about, kind of, I think Doug's in your comments, and thinking about my role as a Fed, and might citizenship be some part of that? I don't know. I won't edit anymore. But thank you.
And I appreciate your comments too. We were just talking, within the graphic of, adding within that context of partners, making it real clear that, the urban directorship, the urban leadership, the urban community, and we've already just kind of started a little bit of, I think, if I recall our conversations, I think the slot that has community members, the intent of that was to be, that bridge between both. But obviously it didn't come across that way, because I do know we had a lot of conversations about that. But, if we can, we will, with your guidance, and thank you, hone that and make it much more identifiable.
And I'm wondering, we talked over here about the IHS might be something on the right side,
Right.
tribal colleges, universities, and that maybe with that.
The other thing too we talked about, and I would be remiss if I didn't spend 30 seconds on this, is we also have a lot of strength in our Indian communities, whether they be urban or reservation based. And we don't look necessarily at our strengths with an evaluation. We have a team of evaluators come in, and historically, our government officials, our community looks at is, what have we done wrong? It's a pass-fail type of thing. And that's ingrained in us. One of the things that we're hoping through this new narrative is we also have a systemic change to look at our strengths are going to guide us. And they're going to come first. And they're going to be identified. And that's a very, very, very different way of looking at this. And so we had a lot of conversation around that as well. So that is hopefully has come across here. We know the stories very acutely that we're reading today in the New York Times. We know the impacts of that. But we also have to know our resilience. And we don't often hear the resilience to the challenges. We don't often hear the strengths of our communities. And the fact that we don't know how to respond to these questions because our language is different and our experience is different, as our sister said at the very beginning. So that's part of the new dialogue, the new narrative, the new approach as well.
So it's after 4, and I know that all of your time here is very, you have many things to do today. Thank you so much for taking the 2 hours this afternoon, or more than 2 hours, to spend with us. Really appreciate it. And we'll be making a couple edits, as you heard, and making sure that everybody here gets links to see the videos, and so you can show your family. No.
Make sure you Photoshop it,
But thanks so much.
And if you do have a chance to digest that document and have thoughts or comments,
Yes.
you can email me.
Yes,
or
we really,
email
the
any of
feedback
us.
is so helpful.
Contact information.
First,
Thank you.
the first.
Thank you very much.